Hello everyone and welcome to AceOSCE's video for today. Thanks for joining me, Alicia, and today I'm going to be covering a very important topic for our management questions and how a pharmacy works in Canada. So I came from India, and there back home you don't really have a very standardized workflow to fill a prescription in a pharmacy. You would usually just go to the chemist, request a couple of capsules of say the amoxicillin. He's going to cut it out, just give it to you in a small brown paper bag, and you're good to go. That's not how things work in Canada, however. Things here are much more standardized, much more regulated. You have regulated health records, you give claims to insurance companies to cover the medications for patients. You have checkpoints to make sure that you're giving the right medication, you're avoiding giving any wrong medication to the patient or any contraindicated medication as well. So I quickly wanted to go over this very important topic with you guys because I saw that most of us IPGs struggle with this a little bit, to show you how a pharmacy usually works and processes the prescription in Canada. So here, and this topic is really important for your management questions, be it you're evaluating MCQ or the OSCE. So once a pharmacy gets a prescription, be it a fax prescription, a verbal prescription, or a physical prescription that a patient gets from their doctor's office, the first step is the data entry. Now, this refers to the part where the pharmacy assistant, the technician, or the pharmacist enters the data of the prescription into the pharmacy software system. So you enter in the doctor's name. So first of all, you open the patient's profile. You make one in case that's a new patient for you by asking for their geographical information, like their their address and their phone number, their date of birth, any allergies, and their insurance information. You can add on any other information such as existing conditions or existing medications just to update your records, and that is a very good practice. Once you've created a profile, or in case you already have a patient profile because they are a regular patient at your pharmacy, you usually scan the prescription in order to keep a scanned record of that prescription, so it's easy to retrieve in case of audits or any questions from the patient. Once that's done, you would enter in the information on the prescription into the patient's profile. So that would involve the doctor's name, it would involve the name of the medication, what is the strength, how much of it you're giving, how they're supposed to be taking it, any type of refills. So all of those are part of something called data entry, where you enter the data on the prescription into the patient's health record. So once that's all done, this prescription electronically goes to either the clinical or the technical verification stage. If it is a new prescription, the pharmacist needs to verify this prescription for therapeutic accuracy, so making sure there's no allergies to the medication that the patient has, the drug dose is correct for the patient's indication, and there's no contraindications to existing therapy, among other therapeutic checks to be done. So those are the three main things the pharmacist looks for in a new prescription. In case the patient is only requesting a refill, what the system usually does is that it pushes it to just technical verification, because the clinical verification had already been done when that prescription was a new prescription. Now, if it is a refill one, sometimes the system only allows you or asks you to do technical check, where you want to make sure that you're giving the right medication and you're giving the right number of tablets, and it's not too early to be given to the patient, just to make sure that there's no inadherence or there's no possible overdose, especially in case of narcotics. And once that is done, you can definitely go ahead with the filling or compounding. Do make sure that the technical verification can be done by the pharmacy technician or the pharmacist. However, the clinical verification, being therapeutic in nature, can only be done by a pharmacist. Once the medication reaches the filling or the compounding stage, this stage is usually the one that involves or gets or has the actual counting of the pills or measuring of the liquid, in case it's a liquid medication that is prescribed, or the compounding of a mixture that has been prescribed for the patient. This is an important step, and most other errors may occur in this step. It could either be miscounting of the medication. So in some pharmacies, you'll see that the pharmacist is triple counting the medications, especially narcotics. Or it may just happen that an assistant thinks that atorvastatin looks pink, and by mistake there was atomoxetine placed right next to the atorvastatin. In a busy day, they may just pick out the atomoxetine, and because both the tablets are pink, they look alike, the assistant can actually just count out the atomoxetine and label it as atorvastatin in error. So those are some errors that may occur in filling, which is why, in order to make sure that the right product is being given to the patient, there is another check called the product check. Now, this is usually done by either the pharmacist or the pharmacy technician. Here, there is a product check screen which usually displays the tablet and how it looks, or at least has the description of how the tablet should look so that the pharmacist can compare their screen with the actual tablets or the pills inside the bottle to make sure that the right medication is being given out to the patient. They also check that the right label has been put onto the prescription, and they also check if the caps are correct. So as most of you are aware, there are two sorts of caps that are usually given out in a pharmacy, either the usual child resistant ones, or there are some things called snap caps or easy open caps, which are requested by patients who are either too old or they have arthritis, so they're not able to open the caps, the regular caps, which usually have to be pushed down and opened out. So in case the patient requests for snap caps, you can document that on their profile and you can give those out to them, so it's easy and convenient for the patient to have access to their medication. So these are a few after the product check happens, the pharmacist usually packages the medication in a small paper bag, labels the medication, keeps it in the fridge in case it is a fridge medication, or keeps it in a basket which the assistants take. And in the pickup area, there are drawers that are usually filed as per the last name of the patient. So in alphabetical order of the last name of the patient, you file those prescriptions so that you don't have to look all over the pharmacy when the patient comes to pick up the prescription. You just ask them for their last name, go into the drawer, and you can retrieve that prescription for them. So it is a very efficient way. A lot of times when we as international pharmacy graduates come to Canada, we are expected to know how pharmacy systems work, especially the evaluating exams sometimes have management questions in them. And at least when I started out, it was really hard for me to understand how a pharmacy works here or why is this step being done. And today, when I was revising this concept with another student, I realized that a lot of us, when we start, don't really know what the steps are that are involved in actually filling out a prescription. And this is, per se, the most basic thing a pharmacy does. If most of you have worked in a pharmacy, you'll know that there's a lot more. There's counselings, there is over-the-counter recommendations, there is faxing the doctors, there is clinical recommendations, flu vaccines, and so much more happening in a pharmacy. So this is the basics that PEBC would expect you to know when you are giving your PEBC, evaluating an MCQ, and even your OSCE exams. And this is the basis of your management questions or ethics questions in your pharmacy exam. So this is a very, very important topic. In case you guys have any questions or want to know more or want to take classes about this, definitely reach out to me. I've made a small little diagram on the left to indicate the drop-off and the pick-up sections, which are usually different in a pharmacy, and where each process of the prescription filling happens in a pharmacy. It usually is in chronological order, so from step 1 to 5, going through steps 2, 3, and 4 in that order. And it is a very well organized layout in most pharmacies. There usually is always one fridge to store insulins or vaccines in the pharmacy. There is inventory at the back so that it's easy for people to walk around in the front of the pharmacy and pick up the medications they're filling from the inventory section of the pharmacy. A lot of pharmacies also have something called a counseling room, which is a small room on one side of the pharmacy where patients may want to come in for their flu shots or their vaccinations. And of course, there are some populations such as women who feel more secure talking or showing whatever their concerns are in a more enclosed space where nobody else can see them, or sometimes you have to discuss some sensitive topics with patients. So those counseling rooms are very handy in those cases. So these are the basic layouts of the pharmacy. This is the basic process that usually happens. Different people can perform different jobs in a pharmacy, so different people have different scopes, giving you another heads up that a pharmacist is the only person in the pharmacy who can do all the steps of filling a prescription, which is why without a pharmacist, the pharmacy cannot open. So that is another thing that you may need to know, that if the pharmacist is not present, or if it's late for them coming, it's a snowstorm outside, they're not able to reach the pharmacy assistant alone cannot open the pharmacy at all. Without the pharmacist present, you cannot open the lock and leaves, which I have covered in one of my videos before, or the pharmacy itself. It is against the law. There are a lot of other things that happen in a pharmacy, like transferring prescriptions or, like I said, giving vaccinations. All of those are going to be things that I will be covering in my classes, which I usually do. But just the basic workflow and what were the steps involved in actually filling out the prescription were my most major concern in order to understand and to explain to you guys how a prescription is filled. One more step that I think I forgot talking about was step number 5, or counseling. So usually for newer prescriptions, the pharmacist counsels the patient as to give them a little overview about the medication. A lot of times, especially in walk-in clinics where doctors are really busy, they forget to tell the patient how to take the medication, and that is what counseling entails. Giving you guys a quick overview of what a prescription needs. So this is an image of a prescription, just a basic layout of what is needed. So usually when you get a prescription, you have the date on either the right or the left side. You need to have a date on the prescription. As much as you know, I think most of you know that benzodiazepine prescriptions would expire from 1 year within the written date, which makes it even more important for such prescriptions to have a date on them. Anywhere on the prescription there needs to be a date. It can be up or down after the doctor's signature, wherever, but there needs to be a date. In most provinces, the prescription usually cannot be filled after 1 year of writing the prescription. So for example, a prescription has a date of 2nd of March 2020. So if somebody comes to your pharmacy with a 2020 dated prescription, you cannot fill it in 2023 because you don't know if that prescription is still needed by the patient or not. He will have to get reassessed and get a new prescription. Now, there must be the patient's name, which has to be there for it to be a legal prescription. In some cases, there may be the age, the gender, the date of birth, or the address written as well. In most prescriptions or most handwritten prescriptions the doctors give out, it usually only has the patient's name or max to max the health card number. However, for most fax prescriptions or computer generated ones, they have the patient's name along with all the other parameters of the patient as well. Now, the prescription itself needs to have the drug, the strength, the directions as to how to use it, how long to use it for in case it's an antibiotic, midday, that is M, or the number of tablets to be given out. R stands for refills, how many refills you can give. Again, brush up your knowledge about the CDSA laws for narcotics and controlled, which medications can have repeats, which cannot. If they do have repeats, what do they need? You'd also need the doctor's name, the signature. The license number should be there, but it isn't absolutely needed, and a verbal order signature by the pharmacist in case it is a verbal order prescription. So again, it was a very quick video, I guess, but this was the basics. Hopefully this kind of helps you guys to understand the pharmacy management questions better and helps you better to answer them. Do definitely reach out to me on the platforms that I've listed here in case you do have any questions for me or want to come in for my mini mock tests or have some revision classes.